Most people experience joint pain at some point in their lives. For many, it's something that comes and goes, but for others, it can become persistent, frustrating, and sometimes worrying. The challenge is that joint pain can have many different causes, and not all of them are serious. So, how do you know when it's something minor and when it's something that needs proper medical assessment? In this video, I'm going to explain the 5 most common causes of joint pain, how to recognize them, and most importantly, when you should consider seeing a specialist. I'm Dr. Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with the most common cause. The first cause of joint pain is osteoarthritis. Osteoarthritis is often described as a wear and tear condition. It occurs when the cartilage within the joint gradually breaks down over time. This can lead to pain, stiffness, and reduced movement. Osteoarthritis typically affects weight-bearing joints such as the knees and hips, but it can also affect the hands. One of the key features of osteoarthritis is that pain tends to worsen with activity and improves with rest. Stiffness is usually short-lived, often lasting just a few minutes after periods of inactivity. This is very different from inflammatory arthritis. The second cause of joint pain is rheumatoid arthritis. This is an autoimmune condition where the immune system attacks the joints, leading to inflammation. Rheumatoid arthritis often affects smaller joints, particularly in the hands and wrists, and tends to occur in a symmetrical pattern. One of the most important features is morning stiffness that lasts more than 30 minutes, sometimes even longer. Patients may also notice swelling in the joints and a general feeling of fatigue. This type of joint pain should not be ignored because early diagnosis and treatment can prevent long-term damage. The third common cause of joint pain is gout. Gout is a type of inflammatory arthritis caused by a buildup of uric acid in the blood. This leads to the formation of crystals within the joint, which can trigger sudden and severe pain. Gout often presents as a very acute episode with rapid onset of pain, redness, and swelling, commonly affecting the big toe. However, it can affect other joints as well. These attacks can be extremely painful, but the condition is very treatable once diagnosed. The fourth cause of joint pain is tendonitis or overuse injury. This is very common, particularly in people who are physically active or have repetitive strain from work or daily activities. Tendonitis occurs when the tendons around a joint become irritated or inflamed. Pain is usually localized and worsens with movement or specific activities. Unlike inflammatory arthritis, it typically does not cause significant swelling of the joint itself or prolonged morning stiffness. The fifth cause of joint pain is other inflammatory or autoimmune conditions. These can include conditions such as psoriatic arthritis, lupus, or other forms of inflammatory arthritis. These conditions can sometimes be more difficult to recognize as symptoms may vary. They may involve joint pain along with other features such as skin changes, fatigue, or involvement of other parts of the body. Now that we've covered the main causes, the most important question is, when should you worry? Joint pain in itself is very common, and in many cases it is not serious. However, there are certain warning signs that should prompt further assessment. If your joint pain lasts more than 6 weeks, that is something that should be looked into. Persistent symptoms are less likely to be due to a simple strain or minor injury. Morning stiffness lasting more than 30 minutes is another key red flag. This suggests inflammation rather than wear and tear. Swelling in the joints is also important. Visible or persistent swelling is not something we would typically expect in simple mechanical joint pain. If your symptoms affect multiple joints, particularly in a symmetrical pattern, that raises concern for inflammatory arthritis. Fatigue is another symptom that is often overlooked. If you have ongoing joint pain along with persistent fatigue, it may suggest a systemic condition. Finally, if your symptoms are impacting your daily life, such as difficulty using your hands, walking, or performing normal activities, that is a sign that you should seek further assessment. One of the key messages I want to emphasize is the importance of early diagnosis. In conditions like rheumatoid arthritis and other inflammatory diseases, there is a window of opportunity where early treatment can significantly improve outcomes. Delaying assessment can lead to ongoing inflammation and potential joint damage. So what should you do if you're experiencing joint pain? The first step is to pay attention to your symptoms. Think about the pattern. when the pain occurs, how long it lasts, and whether there are associated symptoms such as stiffness, swelling, or fatigue. If you have any of the warning signs we've discussed, it's worth seeking medical advice. This may involve seeing your GP initially or a rheumatologist for specialist assessment. At a rheumatology consultation, we would take a detailed history, examine your joints, and arrange appropriate investigations if needed. These may include blood tests and imaging to help determine the cause of your symptoms. The goal is to reach a diagnosis and create a clear plan for managing your condition. Treatment depends entirely on the underlying cause. For osteoarthritis, this may involve exercise, physiotherapy, and pain management. For inflammatory arthritis, treatment focuses on controlling inflammation and preventing joint damage, often with medications such as methotrexate or biologic therapies. For gout, treatment involves managing uric acid levels and preventing further attacks. The key point is that joint pain is not a single condition, it's a symptom with many possible causes. Understanding the differences is the first step towards getting the right treatment. To summarize, the 5 most common causes of joint pain are osteoarthritis, rheumatoid arthritis, gout, tendonitis, and other inflammatory conditions. While many cases of joint pain are not serious, there are important warning signs that should not be ignored. These include persistent pain, prolonged morning stiffness, joint swelling, multiple joint involvement, and fatigue. If you're unsure about your symptoms, it's always better to get them assessed early. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist opinion, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.